Hey guys, Dr. Ben here, Functional Medicine Centers. Excited to talk to you today about diabetes, and we're talking about type 2 diabetes. They used to call this adult onset, but now we're seeing it in kids, teenagers, 20-something-year-olds, lots of different people. It's not just adults anymore, but the great news is this can be reversed. So let's get into it and where diabetes comes from and what you can do to reverse this. So thanks for jumping on Functional Medicine, all about getting to the underlying why. I don't want to just give somebody cinnamon. I don't want to just give them alpha lipoic acid, a supplement to help stabilize their blood sugar. That doesn't fix anything. That doesn't reverse anything. But people are reversing their diabetes left and right with the process that we do all over the country. So welcome, thanks for jumping on. Go ahead and pop down below where you guys are watching from. Love to see it all over the country, all over the world. And we will be getting in depth into where diabetes comes from and what you can do to actually reverse this and change the outcome of somebody's whole pathway, because we know now that they're calling Alzheimer's type 3 diabetes. So if somebody has type 2 diabetes, if they develop insulin resistance, diabetes, things like that, down the road they will get neurological degeneration. If you live long enough and you have diabetes and you have insulin resistance and you have prediabetes, all these things, you will get Alzheimer's. So we know that neurological degeneration is coming. We know there's a lot of other issues with it, but what can you do about it? All right, so where does diabetes come from? Diabetes is not just I ate bad for 6 months or a year. This is more of a lifelong damage that's been taking place. Most people, they start out by going low blood sugar, and for years they dip down low, maybe they spike up, eat something, and then it crashes down and then spikes up, and they're having this yo-yo effect over time. Eventually, they develop what's called insulin resistance, and that's where insulin is the key that unlocks the door to the cell so that glucose can go into that cell. But what happens is when insulin goes over and tries to unlock that keyhole, it will not respond. And so then glucose is floating around, people kick out more insulin, the pancreas is producing more insulin, and we get this elevated insulin, which is inflammatory, and we get this glucose that goes up as well, which causes neurological degeneration, all types of different things. So it's this cascade from years of these ups and downs, we start developing insulin resistance. Once we start getting insulin resistance, then that glucose starts drifting up, then you get prediabetes, and your ferritin starts going up. We see this elevated iron, we see fatty liver start kicking in, we see triglycerides, we see inflammatory markers. A lot of these different cascades start happening. So if someone's been told they have hemochromatosis, 9 times out of 10, that's a blood sugar handling problem, insulin resistance, fatty liver, things like that. So you start going up this path, and then ultimately it turns into diabetes, where that average is way higher. Give me a thumbs up. Has anybody had their A1C tested? And pop down below if you have and you know what number that is, and I'll tell you where you are with that A1C and if we're in the good range or what you need to possibly do about it. So A1C tells us the average of the last 3 months of somebody's blood sugar. So we want to know exactly where someone's been averaging, but that average doesn't always tell us the whole story, because what happens is sometimes the average is good, but we're swinging all over the place. So they might hit 160 and down to 60. Hey Laura, 7.6. All right, so that 7.6 A1C, 5.2 is a perfect number. 5.7 is pre-diabetes. 5.9, we're creeping into the diabetes range. So 7.6 is up at that diabetic level. But get this, we had a lady just last week, we reran her blood work, her 3-month follow-up. She went from 7.2 down to 5.8 in those first 3 months of us working together. She went from full-blown diabetic to barely pre-diabetic and lost a lot of weight, tons more energy, all types of different things. Anybody else know their A1C out there? Pop it down below. So the A1C can change, because remember, that's just the average of the blood sugar. And if it is high, that doesn't mean that somebody is doomed to have diabetes forever. It's kind of like somebody that you've known with high blood pressure. So high blood pressure, that blood pressure goes up, and People will exercise, they'll lose weight, they'll walk a lot, do different things, and their blood pressure goes down and they get off the blood pressure medication. Does that mean that they'll always have high blood pressure? It's just they're controlling it by walking? No, it was the bad things they were doing were making that blood pressure go up. And same thing here, bad things people are doing are making that glucose go up. So it can be reversed, it can be repaired. The insulin resistance can go away, the type 2 diabetes can go away. People are doing it left and right. And then ultimately preventing that neurological degeneration, which is coming from ultimately this inflammatory cascade. So here's the thing with the A1C. Not everybody that's at 5.2, 5.3, 5.4, it's going to still be swinging from 60 to 160. We want people 85 to 110. Hey Laura, how do you get this down? Mine is up and down all the time. So one of the biggest things that you need to do is figure out why your blood sugar is going up too high and why it's going down too low. That's why we use a glucose monitor. We train patients. We've gone through thousands and thousands of glucose monitors and figured out how to get people's blood sugar steady, because there is no one size fits all. There's no diet that fits everybody. Some people can eat a banana and their blood sugar is totally fine. Other people, banana will make them shoot up. Some people, blueberries make them go up. Here's the kicker. Most people that we've seen, sweet potato makes their blood sugar go up way higher than white potato. So very, very unique and individualized to that person. So we've got to go through. We use glucose monitoring. We've got to figure out if their liver's off. We've got to go through and do liver work and cleansing and all those things. We've got to work on their gut. We've got to work on the inflammation, adrenals, whatever else is going on, we've got to go through and work on those. There's no magic bullet. There's no magic supplement to reverse it, but we see it all the time. People come down and really are able to reverse that diabetes. So if you or a loved one or somebody you know that has type 2 diabetes, if they want to, they can truly reverse this issue. A lot of people though, they kind of had to work hard to get there, and changing their diet, changing what they're eating, drinking, things like that can be a challenge. So if somebody's not ready, doesn't want to do those things, it's not going to work. But if somebody's ready and wants to truly take on this challenge of reversing diabetes, hey Suzette, good to see you. Hope you guys are well out there. If you or a loved one or someone you know is truly ready to get their life back, prevent losing toes and fingers and knees and legs and all these things that are happening when people have chronic diabetes. It is fixable. It is reversible. People can change all the time. So what happens then is as you stabilize that blood sugar out, as it stays consistent over time, the insulin resistance starts going away. You start keeping that blood sugar more steady. The average starts going down and that A1C changes. So it's great. Thanks for being on, guys. If you've got specific questions about diabetes or about blood sugar, pop those down below. Love to answer questions of any kind. Share this with anybody that you know that you've got that issue. Do you have any available glucose monitor patches that you got from the conference? Yes, Rachel, go ahead and send us a direct message and we can get you in contact with Becca and she can get you hold of that. All right, Jody, 3rd week of cleansing and blood sugar monitor. All right, keep up the good work. You got this. Your body is changing on the inside and the outside. It's awesome. So love having you guys on. Share this with anybody that you know that's dealing with these issues. It is so prevalent. By 2025, we're going to have 50% of our population in the United States is going to be obese. Not just overweight, but obese. That's like 100 plus pounds, even kids, a lot of different people. And with that is coming these blood sugar imbalances. It's not the obesity that causes the blood sugar, it's the blood sugar that causes the obesity. If we could stabilize everybody's blood sugar in this country, 90% of chronic conditions would go away. I know that because we see it in practice over and over. Laura, we're here to help you. Drop us a line, send us a direct message, and we will talk to you about how we can help get that blood sugar stabilized and reverse that diabetes. So you've got the potential inside of you to heal. You are fated to be healthy and to be vibrant, and you've got it, you've got it, you've got it. All right, take care, guys.